Whether you love walking, dancing, or staying independent, this video is for you. Drop a comment below and tell us where you're watching from. Ask any questions, and don't forget to subscribe and turn on notifications for more health tips from Tri-Fit Zone. Let's build a healthier, stronger future together. As we age, muscle mass declines, bones weaken, and movements become harder. A key reason behind this decline is vitamin D deficiency, often overlooked. Vitamin D plays a crucial role in leg strength, balance, and functionality. Let's explore how ensuring adequate intake can transform mobility and overall well-being. Let's talk about number 1, which is vitamin D. As we grow older, our bodies go through unavoidable changes. Muscle mass decreases, bones become less dense, and movements that once felt effortless may start to feel more difficult. One of the lesser-known reasons behind this decline is a deficiency in vitamin D. This vital nutrient does far more than just support bone health. It plays a crucial role in maintaining leg strength, balance, and overall mobility. Let's explore why vitamin D is so important for aging adults and how getting enough of it can significantly improve movement and well-being. As we age, our skin becomes less effective at producing vitamin D from sunlight. To make matters worse, many older adults spend less time outdoors due to mobility issues, lifestyle changes, or concerns about sun exposure. This combination leads to a widespread deficiency, which weakens muscles and makes legs less stable over time. Scientific research has consistently shown a direct connection between low vitamin D levels and muscle weakness in older adults. In fact, a study published in the Journal of Clinical Endocrinology and Metabolism found that seniors with sufficient vitamin D levels had stronger muscles, better coordination, and improved balance. On the other hand, those who were deficient experienced muscle loss and found simple activities, like climbing stairs or getting up from a chair, much more difficult. Vitamin D does more than just help the body absorb calcium. It directly influences muscle performance. This nutrient helps stimulate protein production and enhances communication between the nerves and muscles, allowing for better control and strength. One of vitamin D's most important roles is in maintaining fast-twitch muscle fibers, which are responsible for quick reactions and balance. These fibers help prevent falls by enabling the legs to react swiftly when balance is compromised. Without enough vitamin D, these muscle fibers weaken, leading to slower movement, reduced strength, and a higher risk of injury. Additionally, vitamin D has been found to reduce muscle inflammation, easing discomfort and pain that many older adults experience. If you suffer from frequent leg cramps, stiffness, or unexplained pain, boosting your vitamin D levels may provide significant relief. A lack of vitamin D doesn't just weaken muscles, it can lead to serious health complications. One of the most concerning is osteoporosis, a condition that makes bones fragile and prone to fractures. Without enough vitamin D, the body struggles to absorb calcium, increasing the likelihood of broken bones from even minor falls. But the risks go beyond bones and muscles. Studies suggest that vitamin D deficiency may also contribute to heart disease, cognitive decline, and a weakened immune system. This means that older adults who don't get enough vitamin D aren't just at risk for mobility issues. They may also face a greater likelihood of developing chronic illnesses that further impact their quality of life. The good news is that preventing vitamin D deficiency is simple, and ensuring adequate levels can lead to life-changing benefits. Here are the best ways to get enough vitamin D. Sunlight exposure. Spending 15 to 30 minutes in the sun, preferably in the morning or late afternoon, helps the body naturally produce vitamin D. Exposing the arms and legs maximizes absorption, though using too much sunscreen can reduce its effectiveness. Vitamin D-rich foods. While food alone may not provide enough vitamin D, incorporating fatty fish, like salmon and mackerel, egg yolks, fortified dairy, beans, and mushrooms can help increase intake. Supplements. For many older adults, especially those who don't get much sun, taking a vitamin D supplement is the most effective way to maintain healthy levels. Most experts recommend 800 to 1,000 IU per day, though higher doses may be necessary for those with severe deficiencies under a doctor's guidance. If you're unsure about your vitamin D levels, a simple blood test can determine whether you're getting enough. Many doctors now routinely check vitamin D levels in older adults, recognizing its essential role in preventing falls and fractures. By prioritizing vitamin D intake, you can support stronger legs, better balance, and overall improved health, helping you stay active and independent as you age. Now let's talk about second vitamin, which is calcium. As we age, our bones naturally lose density, making them more fragile and prone to fractures. Unlike younger individuals whose bones are constantly rebuilding, older adults experience a gradual decline in bone mass. This increases the risk of serious injuries such as hip fractures, femur breaks, and stress fractures in the lower limbs. What might have been a harmless fall in youth can lead to months of recovery or even permanent mobility loss if bones lack the necessary calcium reserves. However, calcium isn't just vital for bone strength. It also plays a crucial role in muscle function. Every movement, from taking a step to standing up from a chair, relies on calcium's ability to trigger muscle contractions. This mineral ensures muscles contract smoothly and with enough force to maintain balance and coordination. Without sufficient calcium, muscles may become weak, cramp frequently, or struggle to function properly. This is why calcium deficiency can lead to sluggish movement, muscle fatigue, and reduced endurance. To keep bones and muscles strong, it's essential to maintain a steady intake of calcium. While dairy products like milk, yogurt, and cheese are well-known sources, there are many other calcium-rich foods to choose from, including leafy greens, kale, bok choy, almonds and tofu sardines, and other small edible bone fish, fortified plant-based milks, soy, almond, oat. A varied diet that includes multiple calcium sources helps improve absorption and supports long-term bone health. For some individuals, dietary intake alone may not be enough, especially those with dietary restrictions or absorption issues. In such cases, calcium supplements can help bridge the gap. However, calcium works best when combined with vitamin D, which enhances the body's ability to absorb and use calcium effectively. That said, more calcium isn't always better. Consuming too much, especially from supplements, can lead to calcium buildup in arteries, kidney stones, and digestive discomfort. Finding the right balance is key. Health experts recommend 1,000 to 1,200 milligrams of calcium per day for older adults, ideally from food sources, with supplements used only when necessary. Calcium intake alone isn't enough to maintain strong bones. Movement is just as important. Weight-bearing exercises such as Walking resistance training. Light jogging helps stimulate bone remodeling and ensure calcium is directed to where it's needed most, the bones and muscles. Without regular physical activity, even adequate calcium intake may not be fully effective in maintaining bone strength. Ignoring calcium needs can do more than weaken bones. It can limit mobility, reduce independence, and make everyday activities more challenging. Strong bones and well-functioning muscles are the foundation of an active, confident, and independent life. Prioritizing calcium intake and regular movement can help ensure stability, prevent fractures, and support long-term well-being. Now let's talk towards third vitamin. Before that, if you are new, hit the subscribe button for getting more knowledge. While discussions about maintaining strong legs often focus on calcium and protein, vitamin B12 is an equally vital yet often overlooked player in muscle and nerve health. This nutrient supports the nervous system by keeping nerves functioning properly, helping electrical signals travel smoothly from the spine to the legs. When B12 levels are low, these signals can get disrupted, leading to muscle weakness, unsteadiness, and a gradual loss of coordination. A common early sign of deficiency is a sensation of heavy, tired legs, sometimes with tingling or numbness. B12 deficiency is surprisingly widespread among older adults. Unlike some vitamins that are easily stored or absorbed from various foods, vitamin B12 relies heavily on proper digestion. The body needs sufficient stomach acid and a protein called intrinsic factor to absorb it. As people age, stomach acid levels naturally decline, and conditions like acid reflux, gastritis, or long-term use of antacids can make matters worse. Combined with a diet low in B12-rich foods, this leads to a gradual depletion that often goes unnoticed. The effects of low B12 can go far beyond just feeling weak. If left unaddressed, it can cause lasting nerve damage, affecting balance, reflexes, and overall movement. Many older individuals who experience frequent falls or trouble walking may actually be dealing with B12-related nerve issues, something that is often mistaken for normal aging but is entirely preventable. The good news is that restoring B12 levels can significantly boost energy, coordination, and leg strength. Research shows that correcting a deficiency can lead to marked improvements in physical function. Since vitamin B12 is mostly found in animal-based foods like meat, fish, eggs, dairy, clams, and liver, those on plant-based diets or with absorption issues may need to rely on fortified foods or supplements. Thankfully, B12 is very safe to take in supplement form, and any excess is usually flushed out in urine. In many cases, older adults benefit from high-dose supplements or regular B12 injections, especially when their bodies struggle to absorb it naturally. Routine blood tests can help track levels and catch deficiencies early before they impact mobility. Ultimately, having strong legs isn't just about muscle. It's also about how well your nerves function. Without proper nerve signaling, even the strongest muscles can't perform properly. That's why maintaining healthy B12 levels is a key, yet often forgotten part of staying mobile and independent as you age. Now talk about next vitamin, which is magnesium. Every time you take a step, magnesium is hard at work behind the scenes. This essential mineral helps your muscles receive the right signals to contract and relax properly. It plays a critical role in keeping your muscles functioning smoothly, preventing spasms, reducing fatigue, and supporting overall endurance. One often overlooked sign of low magnesium levels is restless leg syndrome and frequent leg cramps, especially at night. Many older adults experience sudden, painful muscle contractions in their legs that disturb sleep and make daily recovery more difficult. These symptoms often point to the body struggling to properly manage muscle relaxation. Magnesium helps calm overactive nerves and keeps muscles from tightening up unexpectedly. That makes it especially important for those dealing with chronic muscle tension, cramping, or involuntary movements. But magnesium's benefits extend well beyond just muscles. It's also vital for maintaining strong bones and healthy joints. While calcium usually gets most of the attention for bone health, it needs magnesium to be effective. Magnesium helps transport calcium into the bones and keeps it from accumulating in soft tissues, where it can lead to stiffness and joint discomfort. Research shows that getting enough magnesium can strengthen bones and reduce the risk of fractures in older adults, making it key for staying mobile and active. Unfortunately, magnesium deficiency is widespread, especially in older adults. Stress, medications, and poor eating habits can all drain the body's magnesium stores. Common medications like diuretics, proton pump inhibitors, and certain blood pressure drugs often lower magnesium levels. Add a diet low in magnesium-rich foods, and it's easy to see why so many people come up short. This gradual deficiency can lead to reduced strength, endurance, and flexibility. Many seniors notice they tire more easily, have trouble climbing stairs, or feel sore after even light activity. It's not just aging. It could be a lack of essential nutrients. Replenishing magnesium levels can make a noticeable difference. It often leads to fewer cramps, more energy, and smoother, more comfortable movement. To support your magnesium intake, focus on foods like leafy greens, nuts, seeds, whole grains, legumes, pumpkin seeds, almonds, spinach, black beans, and avocados, all rich in this important mineral. If it's hard to get enough from food alone, supplements can help. Forms like magnesium citrate and magnesium glycinate are well absorbed by the body. When magnesium levels return to normal, the change can be dramatic. Legs feel lighter, movement becomes easier, sleep improves, and even balance and coordination may get a boost. For many, it's the missing piece to feeling more energized, mobile, and steady. Now talk about next vitamin, which is potassium. Have you ever stepped out of bed only to be stopped in your tracks by a sudden calf cramp? If so, you're not alone. Muscle cramps, especially in the legs, are a common sign of low potassium. This essential mineral helps maintain the balance of fluids in and around muscle cells, and when potassium levels drop, muscles can spasm involuntarily, causing those sharp, uncomfortable cramps. For older adults, these cramps can be more than just a nuisance. They can interfere with mobility and quality of life, especially if circulation or muscle mass is already reduced. But potassium's role goes far beyond just preventing cramps. If you've ever felt your legs shaking after standing for too long or noticed stiffness while walking, a lack of potassium could be playing a part. Potassium is key to sending signals between nerves and muscles, which allows for smooth, controlled movement. When there's not enough of it, the connection between your brain and muscles weakens. That can lead to trembling, fatigue, or trouble lifting your feet properly, issues that raise the risk of falls, particularly in older individuals. And it doesn't stop there. Potassium also supports bone health. It helps neutralize excess acid in the body, which can wear down bone density over time. A potassium-rich diet has been linked to slower bone loss and a lower risk of osteoporosis, helping to keep the legs strong and supportive. So how can you make sure you're getting enough potassium? The good news is that many everyday foods are naturally rich in this important mineral. While bananas are well known for their potassium content, there are plenty of other excellent choices. Sweet potatoes, avocados, spinach, beans, oranges, and even baked potatoes, with the skin, offer substantial amounts. Including a variety of these foods in your daily meals can go a long way in keeping your muscles and bones well nourished. For those who find it difficult to meet their potassium needs through food alone, supplements are an option, but they should be used with care. Most adults need around 2,600 milligrams per day for women and 3,400 milligrams for men. These amounts can usually be reached through a balanced diet full of fruits, vegetables, and legumes. However, if you have health conditions like kidney disease or high blood pressure, it's especially important to speak with a healthcare provider before adjusting your potassium intake. In such cases, the body's ability to regulate potassium may be impaired, making personalized guidance essential. When it comes to bone health, calcium and vitamin D often get most of the attention. However, vitamin K is just as essential, ensuring that calcium is properly directed into bones rather than accumulating in arteries or soft tissues, where it can contribute to stiffness, circulation issues, and even heart problems. Think of vitamin K as the body's traffic controller, guiding calcium to the right places to keep your bones strong and your legs mobile. For older adults, this becomes even more important. Research shows that people with higher vitamin K intake tend to have stronger bones, a lower risk of fractures, and better overall bone health. This is because vitamin K activates osteocalcin, a protein that helps bind calcium to the bone matrix, making bones denser and more resistant to fractures. But vitamin K isn't just about bones. It also plays a role in joint and muscle health. Strong legs require more than just good bone density. They also need flexible joints and properly functioning muscles. Vitamin K has been shown to help reduce inflammation in the joints, potentially slowing the progression of osteoarthritis and easing knee stiffness, a common issue among older adults. If your knees feel stiff after sitting for long periods or ache when you move, vitamin K may be the missing nutrient that helps improve mobility. But vitamin K isn't just about bones. It also plays a role in joint and muscle health. Strong legs require more than just good bone density. They also need flexible joints and properly functioning muscles. Vitamin K has been shown to help reduce inflammation in the joints, potentially slowing the progression of osteoarthritis and easing knee stiffness, a common issue among older adults. If your knees feel stiff after sitting for long periods or ache when you move, vitamin K may be the missing nutrient that helps improve mobility. Balance, walking stability, and fall prevention are also linked to muscle strength. Emerging research suggests that vitamin K supports muscle function by regulating calcium within muscle cells, ensuring proper contractions and preventing uncoordinated movements that could lead to instability and falls. Leafy greens like spinach, kale, Swiss chard, collard greens, and Brussels sprouts are excellent sources of vitamin K1, the form most commonly found in plants. However, vitamin K2, which is found in fermented foods like natto, fermented soybeans, aged cheeses, egg yolks, and liver, is particularly beneficial because it stays active in the body longer and plays a greater role in directing calcium into bones instead of arteries. To naturally boost your vitamin K intake, focus on eating more green vegetables and incorporating fermented foods into your diet. Even small changes, like adding kale to a smoothie or sautéing spinach as a side dish, can make a significant difference. For those who have trouble absorbing vitamin K, such as individuals with digestive disorders or those taking long-term antibiotics, supplements may be an option. However, if you take blood-thinning medications like warfarin, it's essential to consult a healthcare professional before increasing your vitamin K intake, as it plays a key role in blood clotting and can interact with these medications. By ensuring you get enough vitamin K, you can support bone density, ease joint discomfort, and improve muscle function, helping you stay active, mobile, and independent for years to come. Lastly, talk about vitamin B6, also known as pyridoxine, is often overlooked when it comes to maintaining strong, healthy legs. While many nutrients contribute to mobility, B6 is essential for nerve function, muscle repair, and efficient protein metabolism, helping the body build and sustain muscle mass. Without enough B6, even simple movements like standing up or climbing stairs can feel unusually tiring as muscles weaken over time. One of the most underestimated roles of vitamin B6 is its impact on nerve signaling and coordination. When B6 levels are low, nerve communication can slow down or become disrupted, leading to numbness, tingling sensations, and unsteady movement. Many older adults mistake these symptoms for muscle loss due to aging, when in reality, their bodies may simply be lacking the right nutrients to maintain proper neuromuscular function. Vitamin B6 also plays a crucial role in reducing inflammation-related muscle fatigue. It helps regulate inflammatory responses, preventing stiffness and keeping muscles more flexible and resilient. If you've been experiencing prolonged soreness or slower recovery after physical activity, increasing your B6 intake could make a significant difference. Beyond muscle function, B6 is essential for red blood cell production. These cells deliver oxygen to the muscles, ensuring they have the energy needed for movement and endurance. A deficiency in B6 can lead to lower hemoglobin levels, which means muscles don't get enough oxygen, resulting in early fatigue, a feeling of heaviness, and decreased stamina. If you often feel unusually tired after short walks or light activity, it could be a sign that your body needs more B6. Luckily, this vital nutrient is found in many common foods. Good sources include poultry, fish, such as salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. Adding these foods to your diet can naturally boost your B6 levels, helping to maintain both muscle strength and nerve function. For individuals with digestive issues, absorption problems, or dietary restrictions, B6 supplements may be necessary to reach optimal levels. The recommended daily intake varies by age and gender, with older adults typically needing around 1.7 milligrams per day for men and 1.5 milligrams for women. By ensuring you get enough vitamin B6, you can improve muscle endurance, enhance nerve communication, and keep your legs feeling strong and energized, helping you stay active and mobile for years to come.